Kidney disease warning signs you can see on your face. Your face might be warning you before any test ever does. The color of your skin, the texture around your eyes, and even the way your cheeks swell can point to hidden kidney trouble. Most people ignore these early signs until fatigue, swelling, and blood pressure rise. But what if you could recognize the danger just by looking in the mirror each morning? Today, you will learn how your face exposes kidney stress before it turns serious. Let's start with one of the most common and overlooked signs that appear right under your eyes: persistent under-eye puffiness. Have you ever looked in the mirror and noticed that your eyes look swollen even after getting enough rest? This kind of puffiness under the eyes may seem like a simple beauty issue, but when it happens regularly, it can be an early visible sign of kidney disease. The area under the eyes contains delicate tissue that easily collects fluid. When the kidneys are not working efficiently, they cannot remove excess sodium and waste from the body, and that trapped fluid often shows up first as under-eye swelling. According to the National Institute of Diabetes and Digestive and Kidney Diseases, puffiness that appears every morning and does not fade quickly can signal early kidney stress. During sleep, fluid naturally moves toward the upper body. If your kidneys cannot process it properly, it gathers under the eyes. That is why people with kidney issues often notice swelling in the morning that gradually improves during the day. Many dismiss it as tiredness or late-night screen time, but the real reason could be poor fluid balance. There are, of course, other causes of puffiness such as allergies, sinus problems, or sleeping with your head too flat. However, puffiness linked to kidney function feels different. It usually affects both eyes equally, feels soft to touch, and does not respond much to common home remedies. Have you ever tried cold spoons or eye creams and noticed that the puffiness keeps coming back? When that happens, the problem is likely internal rather than cosmetic. Adults over 40 are more likely to notice this issue, as kidney efficiency naturally declines with age. People who consume too much salt or processed food, or those who regularly take painkillers and blood pressure medicines, are also at risk. These factors increase sodium levels in the blood, and when sodium builds up, water follows it into tissues, creating visible swelling. People with a family history of kidney or heart problems should be extra careful because genetics can make the kidneys more sensitive to such imbalances. A quick way to check for fluid buildup is by pressing lightly under the eyes. If a small dent stays for a few seconds, it might indicate water retention. That does not confirm kidney disease, but it means your body is holding more fluid than it should. In that case, small lifestyle changes can make a difference. Cutting back on salty snacks and frozen meals can help reduce water retention. Adding potassium-rich foods such as bananas, spinach, and sweet potatoes can also balance sodium levels and support kidney function. Research from the Mayo Clinic shows that controlling sodium intake and blood pressure can significantly reduce swelling caused by kidney strain. This means that simple choices like cooking fresh meals at home and drinking enough water during the day can help ease the workload on your kidneys. Do you ever notice your eyes look puffier after eating fast food or salty soup at night? That is your body holding onto fluid because the kidneys cannot keep up with the extra sodium. It is important to remember that not all puffiness comes from kidney issues, but persistent puffiness that lasts for weeks or months should not be ignored. It can also appear alongside other subtle signs such as fatigue, reduced urine output, or foamy urine. These signs together may point toward a kidney-related cause and should be discussed with a healthcare professional. Now we move from swelling to something that changes the color and texture of the skin. The next facial clue often appears around the lips and cheeks and tells another part of the story about your kidney health warning signs. It is the pale or grayish skin tone. Before we continue, tell me where you're watching from and what stage your kidney disease is in right now. If you're living with stage 3 or above kidney disease and want practical ways to manage symptoms naturally, make sure to subscribe to Kidnease and tap the bell icon. And if this video is helping you so far, type 1 in the comments. A healthy face usually carries a natural warmth and colour, but when kidneys start to struggle, that tone can fade away slowly. The skin may begin to look pale, greyish, or even dull, no matter how much rest or hydration a person gets. This happens because damaged kidneys stop producing enough erythropoietin, a hormone that tells the bone marrow to make red blood cells. When red blood cell levels drop, oxygen delivery to tissues decreases, causing the skin to lose its usual brightness and healthy tone. According to Johns Hopkins Medicine, this reduction in erythropoietin is one of the earliest indicators of chronic kidney stress. It can lead to a gradual change in skin appearance, most visible around the lips, nose, and under eye area where the skin is thinner and more transparent. Without enough oxygenated blood flowing through those tiny vessels, the face may look washed out, as if colour has drained away. For many people, this change becomes noticeable before other kidney-related symptoms appear. This issue often affects individuals who already live with conditions that strain the kidneys, such as diabetes or high blood pressure. Both of these can damage small blood vessels inside the kidneys, making it harder for them to maintain healthy hormone production. The National Kidney Foundation notes that nearly half of chronic kidney disease patients develop anemia due to this disruption. That is why a dull or pale complexion should never be ignored, especially if it develops slowly and stays constant. Of course, not every case of pale skin means kidney disease. Sometimes low iron levels, thyroid problems, or poor nutrition can create a similar effect. However, those usually improve once the body gets enough nutrients or proper treatment. When skin pallor continues despite eating well and resting properly, it may signal kidney-related anemia. A simple self-check can offer clues. Press gently on the lower lip or nail bed and see how fast the colour returns. If it takes more than a couple of seconds, the blood may not be carrying enough oxygen. Improving this condition starts with restoring both kidney and blood health. Iron-rich foods like spinach, lentils, beans, and fortified cereals can boost red blood cell production. Staying hydrated helps kidneys filter efficiently, while keeping blood pressure and blood sugar under control prevents further strain. Skin tone often mirrors internal health, so noticing a loss of colour can be a valuable early sign to seek medical advice. If this information feels useful, please hit the like button. It might seem small, but it helps YouTube show Kidnease to more people living with stage 3 or above kidney disease who truly need this kind of support. Your single click helps others find hope too. Now we turn to something many people confuse with dryness or seasonal allergies, but it often points to toxin buildup beneath the surface. The next clue is itchy or dry skin, a signal that your kidneys may be struggling to keep your system balanced. When facial skin starts feeling dry, tight, or constantly itchy no matter how much moisturizer is used, it might be more than just a surface problem. The skin is one of the first organs to reflect internal imbalance, and when kidneys begin to struggle, that imbalance often shows up as dryness or irritation. Healthy kidneys control the level of minerals in the body, especially phosphorus and calcium. When they do not function properly, these minerals build up in the bloodstream and irritate nerve endings in the skin, leading to a deep, persistent itch that simple creams cannot relieve. According to research from the Cleveland Clinic, this condition, known as uremic pruritus, affects about 40% of people with chronic kidney disease. The itching may start subtly, often on the face, neck, or arms, before spreading elsewhere. It can happen during the day or intensify at night when skin temperature and circulation change. Many people describe it as an itch that feels under the skin rather than on the surface. That sensation happens because excess waste in the blood interacts with nerve fibers and alters the skin's response to even minor irritation. Sometimes the skin might also look slightly flaky or dull, especially around the cheeks or jawline. The tightness can feel similar to dehydration, yet even after applying hydrating products, the dryness remains. Unlike allergies or eczema, kidney-related itching usually comes without a rash, redness, or visible inflammation. It simply lingers and may worsen with heat, sweat, or stress. This kind of dryness can also appear when sweat glands do not function properly due to toxin buildup, making the skin less able to retain moisture naturally. People who have diabetes, high blood pressure, or a history of dehydration are more likely to experience this problem because these conditions can weaken the kidneys gradually. When toxins are not cleared effectively, the skin becomes one of the exit points for waste, which triggers irritation. Have you ever experienced persistent facial dryness or itching that no cream could fix? Comment below and share any other unusual symptoms you've noticed. To ease this discomfort, hydration should always start from the inside. Drinking water early in the day helps the kidneys flush out minerals before they accumulate. Overloading on caffeine can do the opposite by dehydrating the body and forcing the kidneys to work harder. Using mild, fragrance-free moisturizers that contain ceramides can help strengthen the skin barrier, while avoiding products with alcohol or synthetic fragrance prevents further dryness. Simple steps, such as using a humidifier in dry indoor environments, can also make a noticeable difference. The skin constantly communicates with the body, and ignoring its signals can allow deeper issues to grow unnoticed. If persistent facial dryness or itching continues despite lifestyle changes and good skincare, it is important to get kidney function checked through routine blood and urine tests. Addressing the root cause not only relieves discomfort, but also protects overall health. Now we move from dryness to something that may appear even more visible in mirrors or selfies. It is a shift in facial color that often catches people by surprise. The next sign to notice is yellowish or sallow skin. A healthy complexion often carries a natural glow, but when kidneys start losing their efficiency, that brightness can slowly fade and take on a yellow or waxy tone. This subtle change often begins around the temples, nose, and under the eyes, where skin is thinnest and more reflective of blood composition. The reason lies deep within the body's filtration system. When kidneys cannot properly remove waste like urea and other toxins, these substances start building up in the bloodstream. Over time, they alter how the body processes vitamins and pigments, leading to dull or yellowish skin. According to Harvard Health, the accumulation of these waste compounds can change the way the skin reflects light, giving it a tired, sallow look long before medical tests confirm kidney decline. One of the key substances responsible for this color shift is called urochrome. Under normal conditions, kidneys filter urochrome out through urine, which gives urine its pale yellow tint. But when that process slows, urochrome can remain in the blood and settle into skin tissues. That buildup subtly colors the skin with a yellowish cast that does not wash away or improve with rest. This discoloration can appear similar to liver-related jaundice, which also produces yellow skin. However, there are differences. In liver issues, the yellow tone tends to be brighter and often affects the whites of the eyes. With kidney-related discoloration, the shade is usually duller and waxier, often paired with other symptoms such as fatigue, puffiness, and reduced urine output. Vitamin B12 deficiency can also cause a pale yellow tone, but it typically comes with tingling in the hands or mouth sores. These distinctions matter because they guide whether someone should look toward the liver, nutrition, or kidney function as the main concern. People most at risk for this symptom are those dealing with long-standing diabetes, high-protein diets, or chronic dehydration. When the body processes excess protein, the kidneys work harder to clear nitrogen waste. If hydration levels stay low, those waste products remain concentrated in the blood, which can make skin tone appear more yellow over time. Dehydration also limits the skin's ability to stay elastic and clear, so the overall appearance becomes more tired and uneven. To prevent this condition from progressing, hydration plays a major role. Drinking enough water helps kidneys flush toxins more efficiently and prevents buildup in the bloodstream. A diet rich in antioxidants from foods like blueberries, kale, and citrus fruits supports both liver and kidney detoxification processes. People who rely on protein powders or high-protein diets should balance their intake with plenty of fluids and medical supervision, since excessive protein can place unnecessary strain on already vulnerable kidneys. Sometimes people only notice these color changes in photos or under bright lighting, which makes them easy to ignore. But skin tone changes, especially around the eyes and temples, can signal that the kidneys are asking for help. Addressing it early through balanced nutrition, hydration, and regular kidney checkups can prevent further complications and restore the skin's natural tone. Now we'll focus on something that changes not in color but in shape. It is often noticed first in mirrors or morning photos and tells another story of how kidneys handle fluid balance. The next clue is facial puffiness and swelling around the jawline. Facial puffiness is something many people notice in the mirror, yet rarely connect with kidney health. It starts subtly, maybe just a little swelling along the cheeks or under the jawline that looks harmless at first. But when kidneys begin to lose their ability to remove extra sodium and fluids, this fluid starts to accumulate under the skin. It often becomes more visible in the morning because the body stays in one position during sleep, making it harder for fluid to circulate properly. Over time, this trapped fluid makes the face look fuller and gives it a firm or spongy texture. Many people confuse it with a normal bloating reaction, but the real reason often lies deeper in how the kidneys balance salt and water inside the body. When kidney filtration slows down, sodium retention increases, and cells begin to pull in more water to restore balance. This extra fluid moves into soft tissues, mainly in areas where the skin is thinner, such as the eyelids, cheeks, and jawline. According to research from the Mayo Clinic, this condition, known as edema, is one of the earliest external signs of compromised kidney function. It is not always severe in the beginning, which makes it easy to overlook. The swelling usually feels soft, but can turn firm over time as the fluid builds up. Unlike allergic puffiness that appears suddenly and may itch or feel warm, kidney-related swelling progresses slowly and often pairs with puffiness in the hands, ankles, or feet. Have you ever noticed your face looking puffier in the morning even after sleeping well? That could be your body's way of signaling fluid imbalance. This gradual buildup usually starts when the kidneys can no longer filter blood efficiently or when excess protein leaks through the urine, a condition known as proteinuria. Protein helps keep fluid inside the blood vessels, so when levels drop, fluid escapes into nearby tissues. This is why some people with kidney concerns notice not only facial puffiness, but also a heavy feeling around the eyes or tightness under the skin. Those who lead sedentary lives, eat salty foods often, or spend long hours sitting are more likely to experience this kind of swelling. A diet high in processed snacks, canned meals, or restaurant food can load the body with hidden sodium, forcing the kidneys to work harder to flush it out. When the filtration process becomes overloaded, even small amounts of retained fluid can alter how your face looks. Regular physical movement helps maintain circulation, while staying hydrated supports the kidneys in flushing waste effectively. Interestingly, both dehydration and overhydration can worsen the problem. When you drink too little, the body holds on to water. When you drink too much, it can overwhelm already struggling kidneys. Therefore, finding the right balance is key. A simple self-test can offer an early clue. Gently press along your jawline or under the eyes. If the skin forms a shallow pit and takes a few seconds to return to normal, that may be a sign of retained fluid. However, this should never replace professional advice. If puffiness lasts more than 2 days or gets worse after lying down, it is time to consult a healthcare provider. Persistent facial swelling could indicate that the kidneys are not maintaining fluid balance as they should. Reducing sodium intake, staying physically active, and keeping your blood pressure under control can make a major difference. Research from Harvard Health also suggests that antioxidant-rich foods, such as leafy greens, citrus fruits, and berries, can support the body's natural detoxification process and reduce inflammation that worsens fluid retention. Maintaining this balance can not only improve kidney health, but also gradually reduce facial swelling. Now that you've learned about visible signs, let's shift to a bonus tip that supports kidney health from the inside out: gentle lymphatic face massage. Gentle lymphatic face massage is not just a beauty trend, it is a simple way to support the body's natural detox system and help the kidneys do their job more effectively. This massage helps fluids move through the lymph channels, which are part of the body's internal drainage network. These channels carry waste materials, toxins, and extra fluid away from the tissues, sending them toward the kidneys and liver for processing. When this system slows down due to poor lifestyle habits or lack of movement, the face can start to look puffy or dull. Encouraging lymph flow through gentle massage can make a real difference in how fresh and healthy the skin appears. The lymphatic system has no pump of its own, so it depends on muscle movement and manual stimulation to stay active. A few minutes of massage each day helps increase circulation and move stagnant fluid out of the facial tissues. When this happens, the load on the kidneys slightly decreases, allowing them to manage fluid balance more efficiently. Research from the University of Southern California School of Medicine found that gentle lymphatic stimulation can reduce the buildup of interstitial fluid, which is the space between cells where extra water and waste often collect. Over time, regular stimulation can help prevent the kind of swelling that develops around the eyes or jawline when kidney function slows down. To perform it safely, always begin with clean hands or a smooth tool such as a jade roller or gua sha stone. Place your fingers at the sides of the nose and glide outward toward the temples using slow, light motions. Then move down along the neck where the lymph nodes are located. This downward motion helps direct trapped fluid toward areas that naturally drain waste from the body. Keep the movements gentle, never pressing too hard, because excessive pressure can irritate the skin or cause redness. Doing this routine for 5 to 10 minutes each evening can not only reduce puffiness, but also promote relaxation, which supports better circulation throughout the body. Have you ever noticed how stress or lack of sleep makes your face look swollen or tired? This massage helps counter that effect by increasing oxygen flow and encouraging better hydration inside skin cells. When combined with proper water intake and a balanced salt diet, it keeps the lymph and blood systems working in harmony. People who spend long hours sitting at desks or those who experience mild water retention often benefit the most from this practice. It can even complement professional treatments because it naturally supports the body's own filtration and cleansing mechanisms. However, it is important to avoid this method if you have active skin infections, open cuts, or severe acne, as stimulation may worsen inflammation. Always make sure your hands and tools are sanitized to prevent bacterial spread. The key is consistency and gentle care, not intensity. A few minutes each day can bring gradual but noticeable improvements in how your skin feels and looks. We have covered how your face can reflect what is happening deep inside your body. Now, let's bring everything together in a quick recap. Your face can quietly mirror your kidney health. Under-eye puffiness often signals early fluid retention and protein imbalance. Pale or grey skin tone may point to reduced red blood cell production due to kidney strain. Itchy or dry skin can suggest mineral imbalance caused by poor filtration. A yellowish or sallow hue can come from toxin buildup altering skin pigment. Facial swelling around the jawline often shows sodium and water retention, and the gentle lymphatic face massage helps boost circulation and drainage, supporting your kidneys in maintaining internal balance. Recognizing these signs early helps protect your kidneys and overall well-being long before the problem becomes serious. If today's video gave you clarity or comfort, don't leave without subscribing to Kidnease. We focus on stage 3 and above kidney disease, so every video is made for you. And if you felt this really spoke to your experience, type relief in the comments so I know it helped.